All the students passing out of high schools continue their education and don't drop out, my government has decided to establish at least 2 junior colleges per mandal across the state, out of which one shall be exclusively for girls. My government is giving utmost importance to higher education. Andhra Pradesh is the only state in the country to take complete responsibility for providing higher education to 100% of its eligible students free of cost without any financial burden on their families. The government has initiated path-breaking reforms to transform the youth of the state into enlightened and employable global citizens ready to tackle future global challenges. With a view to ensuring that higher education is accessible even to children of disadvantaged sections, my government is reimbursing total fees under Jagananna Vidya Dinena. Under the scheme, the amount is transferred directly on a quarterly basis into the accounts of such mothers whose children pursue ITI, polytechnic, degree, engineering, B Pharmacy and other courses. So far, rupees 9,249 crores have been reimbursed to 24.75 lakh beneficiaries. Through Jagananna Vasati Divena, we are providing allowance up to rupees 20,000 for hostel and mess charges. Under the scheme, amount is credited directly into the accounts of mothers whose children are pursuing higher education. So far, an amount of rupees 3,366 crores has been disbursed to 18.77 lakh students under the scheme. Effective implementation of equitable and inclusive schemes like Jagananna Vidya Divena and Jagananna Vasati Divena has resulted in significant improvements in gross enrollment ratio in Andhra Pradesh. The government has also established new higher educational institutions such as Tribal Engineering College at Kurupam, JNTU Gurajada at Vizianagaram, Andhra Kesari University at Ongole, Dr. YSR Architecture and Fine Arts University at YSR Kadapa, Cluster University at Kurnool, and 14 government degree colleges to provide accessible and inclusive higher education. For the first time in the country, my government has created a 50% government quota in medical dental courses and a 35% government quota in all other courses in private universities in the state. Meritorious poor students are provided admission to private universities following the rule of reservation. Good health and well-being, the key pillars of a healthy society. Dennis Waitley had said, and I quote, "Time and health are two precious assets that we don't recognize and appreciate until they have been depleted," unquote. Providing access to health facilities for all citizens and achieving universal health coverage is one of the key priorities of my government. My government is providing quality health care free of cost for all through Dr. YSR Arogya Shri scheme. The scheme covers about 1.41 crore families, and this constitutes nearly 95% of the state's population. The procedures covered under Dr. YSR Arogya Shri program have been increased from 2,446 to 3,255 from October 2022. The scheme coverage now extends outside the state to the cities of Hyderabad, Chennai and Bangalore for 716 super specialty procedures in a significant move to help the citizens, especially the poor. COVID-19 treatment has been brought under Arogya Shri umbrella. 1.41 crore smart health cards with QR code are issued to the eligible beneficiaries under Dr. YSR Arogya Shri scheme. Furthermore, under Dr. YSR Arogya Asara scheme, a maximum of rupees 5,000 per month is provided as financial assistance to patients for the post-surgery care, recognizing the need to compensate for their lost working ability. So far, an amount of rupees 971.28 crores has been spent benefiting 15.65 lakh persons. As a result of effective implementation of mother and child care services in the state, there has been a phenomenal decline of 19% in the maternal mortality ratio, which has steeply declined to 45. The state stood fourth at the national level as per the latest SRS report, and the state has already achieved the SDG target of 70 per 1 lakh live births well before the timeline of the year 2030. Under the 5-child mortality rate too has witnessed a 13% decline and stood at 27% per 1,000 live births as per the latest SRS report, and inching towards the SDG target of 25 per 1,000 live births by 2030. My government has formulated the Family Physician Program intended to extend the healthcare services at the doorsteps of the community through the medical officers to deliver curative care in addition to prevention of diseases. Under this program, medical officers will visit Dr. YSR village health clinics twice in a month to deliver the priority medical services along with CHOs, ANMs, ASHAs and other PHC staff. To achieve the objective under the family physician concept, 2 doctors are made available in all the PHCs on permanent recruitment, with 1 doctor attending the PHC and the other attending the YSR village health clinic through 104 MMU vehicles on fixed day schedule to provide the healthcare services. My government is committed to reducing the infant mortality rate by strengthening neonatal care services. To reduce the neonatal mortality, my government is undertaking expansion and strengthening of facilities like special newborn care units, MINI, tribal special newborn care units, nutritional rehabilitation centers. Leveraging technology, better health care access is being provided to the citizens in the state through Dr. YSR telemedicine. Total 2.83 crore teleconsultations have been done through telemedicine, which account for 35% of the total consultations in India, the highest done by any state in the country. My government has launched a comprehensive program of Nadu Nedu for remodeling government hospitals, upgradation of infrastructure facilities and healthcare services across the state in a phased manner over a period of 3 years. As a part of this initiative, 10,032 YSR village health clinics, 528 urban health clinics, 1,124 PHCs, 121 CHCs and 42 area hospitals are being upgraded. My government has already revamped the 108 ambulances and 104 mobile medical units with modern life-saving equipment. The village health clinics positioned adjacent to the village ward secretariats provide primary health care to the needy at the grassroots level. To ensure that best medical care, my government is establishing 17 medical colleges in addition to the existing 11 medical colleges in the state with an outlay of 8,480 crores. 5 of these 17 new medical colleges will start functioning from the academic year 2023-24. With the objective of reducing avoidable blindness from 1% to 0.3%, Dr. YSR Kanti Velugu scheme is being implemented in the state in 6 phases, targeting specific population in each phase and to screen 5.60 crore population in the state with an estimated outlay of rupees 560.89 crores. To holistically achieve the health objectives, my government has decided to fill up all the vacant posts in health institutions in the state. Towards this end, in all, 48,639 vacant posts have been filled up. These include 3,899 specialists, 2,088 medical officers, 5,777 staff nurses, 13,540 ANMS, 10,032 mid-level health providers, 13,303 paramedical and support staff. All these efforts will surely minimize the out-of-pocket expenses of the poor and also bring significant improvements in the health parameters. Prioritizing sustainable development goals, my government is taking various innovative steps to improve the nutritional status of beneficiaries under Anganwadi services. My government has put in place several health and nutrition related schemes to make sure that state will achieve the global benchmarks and improve the performance under stunting, wasting and malnutrition. Committed to achieving the SDGs well in time, my government has laid special focus on closely monitoring the anemia and malnutrition related indicators. 4 of the 8 high priority SDG related indicators being monitored at the highest level on a regular basis pertain to these key 2 parameters. My government has introduced YSR Sampurna Poshana and YSR Sampurna Poshana Plus schemes for supplementary nutrition through Anganwadi centers beside the Poshana Abhiyan scheme of the Government of India. My government is adopting a convergence approach to improve the nutrition of pregnant women, lactating mothers and children. Through this holistic supplementary nutrition program, a total of 35.7 lakh beneficiaries have been supported. An amount of rupees 6,141 crores has been incurred on this program so far. My government is committed to provide permanent houses to all eligible people by 2024 by providing house sites and houses under Navaratnalu Pedal Andiriki Illu program. Under the program, 30.65 lakh house sites pattas were distributed in the name of women beneficiaries. The value of each such house site is to the tune of 5 to 10 lakhs. So far, 21.25 lakh houses have been sanctioned to the beneficiaries. 4.4 lakh have been completed and the remaining houses are at various stages of construction. It is also to be noted that all YSR Jagananna colonies are being developed by providing all the required infrastructure facilities like water supply, electricity, approach roads, internal roads, drains and welcome arches. Infrastructure works worth rupees 32,909 crores are being planned in all the layouts. For the first time in India, all types of pensions under YSR Pension Kanuka are being delivered on the first of every month at the doorsteps of the beneficiaries through village ward voluntary network. So far, an expenditure of rupees 66,823.79 crores has been incurred, benefiting 64.45 lakh persons every month. Every BPL weaver family who owns a handloom is provided with rupees 24,000 per annum to modernize its equipment under YSR Nethanna Nestam. Rupees 788.5 crore has been distributed to 81,783 weaver beneficiaries so far. The YSR Matsyakara Bharosa stands unique in the country, where relief to fishermen is extended during the lean period. The relief provided to marine fishermen families during the fishing ban period has been enhanced from rupees 4,000 to rupees 10,000, and diesel subsidy is also enhanced from rupees 6 to rupees 9 per litre. So far, an amount of rupees 422 crores has been credited to 1.2 lakh eligible beneficiaries. Furthermore, the ex gratia to the family of any fisherman who dies in high seas has been increased from rupees 5 lakhs to rupees 10 lakhs. Through Jagananna Chedodu, a financial assistance of rupees 10,000 is given to the eligible fishermen, Nai Brahmins and tailors who have registered permanent or mobile establishments. An amount of rupees 927.49 crores has been directly credited into the accounts of 3.30 lakh beneficiaries under the scheme. Social security insurance cover is being provided to unorganized sectors workers of the age group 18 to 70 years under YSR Bima program for accidental deaths, natural deaths and full and partial disability incidents. So far, claims to a tune of rupees 500 crores has been disbursed during the last 2 years. An annual cash incentive of rupees 10,000 under YSR Vahana Mitra scheme is provided to all eligible driver cum owners of autos, taxis and maxi cabs to meet maintenance expenses. During the last 4 years, an amount of rupees 1,041 crores was distributed to 2.74 lakh beneficiaries. Through YSR Law Nestam, my government is providing a half-yearly stipend of rupees 30,000 to eligible junior advocates. An amount of rupees 35.4 crores was distributed to 4,248 eligible junior advocates so far. To help street vendors in their effort to access working capital at affordable rates, my government is providing rupees 10,000 loan amount with 0% interest under Jagananna Todu scheme. Under the scheme so far, 2,470.3 crore was disbursed to 15.31 lakh beneficiaries, and the interest amount was also reimbursed. Now on women empowerment. My government has laid utmost emphasis on the empowerment and welfare of women. Recognizing the need for political empowerment of women, my government has provided 50% reservation for women in all local bodies. Further, by way of an act, women have been provided with 50% reservation in all nominated posts and nominated works. Under the YSR Asara, Under the YSR Asara, my government has helped the SHG women of rural and urban areas who had availed bank finance to meet their financial needs by reimbursing the entire loan amount outstanding as on 11/4/29 in 4 installments. An amount of rupees 12,758 crores was released in 2 installments to 78.74 lakh SHG women in both rural and urban areas. To absolve the women of the debt trap and free them from the financial burden, my government has introduced YSR Sunnavaddi scheme, through which the interest amount on the loan will be reimbursed directly to the account of SHG. So far, an amount of rupees 3,615 crores was paid to 1.02 crore SHG women. Through YSR Cheyuta scheme, a financial assistance of rupees 75,000 is provided in 4 phases to all eligible women belonging to SC, ST, BC and minorities in the age group of 45 to 60 years. At 18,750 per year, an amount of rupees 14,129 crores was disbursed in 3 installments to 26.7 lakh women members under the scheme. My government has devised a new scheme, YSR EBC Nestam, to extend financial assistance to women belonging to economically backward classes. Under the scheme, my government will provide financial assistance of rupees 45,000 to each woman beneficiary aged between 45 to 60 years at rupees 15,000 per annum for 3 years. So far, an amount of rupees 595.86 crores has been credited directly into the accounts of 3.94 lakh women. Under YSR Kapu Nestam, my government is providing financial assistance of rupees 75,000 in 5 phases to women who are in the age group of 45 to 60 years belonging to Kapu, Telaga, Ontari and Balija castes at rupees 15,000 per year. So far, an amount of rupees 1,500 crores was paid to 3.56 lakh women. To financially empower the eligible brides and their families, the government has significantly enhanced the incentive and introduced the YSR Kalyana Mastu for SC, ST, BC, minorities other than Muslims differently abled and YSR Shadi Tofa for Muslim minorities. The scheme is implemented on saturation basis in a transparent manner through the Grama Ward Sachivalayams to ensure that poverty does not come in the way of education. Mothers who send their children to schools and educational institutions are supported by providing financial assistance in the form of various schemes like Amma Odi, Jagananna Vidya Divena and Jagananna Vasati Divena. Also, all the house site pattas were given in the name of women beneficiaries and distributed to women beneficiaries only. My government has launched YSR Swechha scheme on International Women's Day 2021 with an aim to ensure accessibility to good health and hygiene among adolescent girls and women. So far, an amount of rupees 25.33 crores has been spent on this program. To help women in distress, Disha app was launched by our government. any woman, any woman in distress.
Government of India rejected. This is rejected by Government of India.
Wait. Any woman in distress can either call police or by simply shaking the mobile, the police will come to her rescue within minutes. This app has received tremendous response with over 1.36 crores downloads till date and 1.11 crore registered users. As a comprehensive measure to address the issues that directly or indirectly concern women and girl child, for the first time, my government has presented gender budget during budget sessions 2021-22. Social justice now. Recognizing that social justice cannot be attained without political empowerment, my government has taken several measures to empower economically and socially deprived sections of the society. Within the Council of Ministers, 50% of the posts in the first round and 70% of the posts in second round were given to SC, ST, BC and minorities. Furthermore, out of 5 deputy CM posts, 4 posts, that is 80% were given to SC, ST, BC minorities. Within the Zilla Parishad chairman posts, within the Zilla Parishad chairman posts, 9 posts, that is 70% out of 13 were given to SC, ST, BC and minorities. Furthermore, my government has ensured that among nominated posts and nominated works, 50% be reserved to SC, ST, BC and minorities, and an act has been brought to this effect. Accordingly, out of 137 various corporation chairman posts, 58% were given to SC, ST, BC and minorities. To look after the welfare of the backward classes and to implement the government schemes designed for BCs, 56 new BC corporations have been established, duly covering 139 castes. 3 corporations were formed for SCs and 1 corporation has been formed for STs to effectively implement the programs of the government for these sections of the society. My government is implementing various other schemes that directly promote improvement and well-being of the underprivileged and vulnerable classes. These include providing free power to 15.14 lakh SC and 4.5 lakh ST households up to 200 units per month under the Jagjeevan Jyoti scheme. I feel very happy to mention that my government during the past 45 months has implemented several schemes in a transparent manner by transferring an amount of rupees 1.97 lakh crores through DBT mode directly into the bank accounts of the needy and intended beneficiaries. Now about sustainable agricultural production and consumption. Paul Chatfield had said, and I quote, "Agriculture is the noblest of the alchemy. Agriculture is the noblest of the alchemy, for it turns earth and even manure into gold, conferring upon its cultivator the additional reward of health," unquote. Dear members, a resilient farming sector remained as the mainstay for the state economy during COVID times. My government will leave no stone unturned in making agriculture viable and profitable. Let me briefly highlight some of the schemes implemented by the state for the well-being of the farmers in the state. Establishment of 10,778 Raitu Bharosa Kendralu turned out to be a one-stop solution to all the agricultural needs, along with e-crop booking facility that range from providing quality certified key farm inputs to enabling sale of end produce. One RBK is established in every village secretariat with the agriculture, horticulture, fisheries graduate. Further, with an objective of monitoring the prices of commodities daily at RBK level and prioritizing procurements wherever and whenever necessary, my government is leveraging digital technologies through the usage of continuous monitoring of agricultural prices and procurement. An entire procurement process was re-engineered and digitalized. The e-crop booking put in place at the RBK level itself is acting as a single source for effective policy formulation and implementation of programs such as universal free crop insurance, input subsidy, interest-free crop loans, and procurement of agricultural produce at MSP, along with area-specific guidance for farmers. Further, kiosks are made available at the RBKs so that farmers can now place orders for farm inputs online for delivery at their doorstep. An integrated call center with agri-scientists in place is made available to advise farmers on various crop-related issues. With all these initiatives and RBKs playing a central role with community hiring centers coming up at RBK level itself, promotion of crop diversification, migration of millets production, and switching over to organic farming gradually have all resulted in the sector demonstrating commendable performance. Under the YSR Raitu Bharosa PM Kisan financial assistance of rupees 13,500 is extended to the farmer in 3 installments per year for a period of 5 years, amounting to rupees 67,500 as an input support, and my government is the only one to extend the scheme to landless tenant farmers, ROFR cultivators, and cultivators of endowment lands. So far, under this scheme, 52.38 lakh farmer families were benefited with an amount of rupees 27,063 crores. To protect all farmers cultivating agriculture and horticulture crops, universal crop insurance is implemented wherein farmers' share of premium is paid by the state government for all crops notified under the YSR free crop